Hello, my name is Lola Shermanura, and I'll be doing a presentation on the theory application and evaluation of theories in relation to my research project. So the title of my research project is A Need for Community-Based Research, exploring the beliefs and challenges of the various factors contributing to poor asthma control in African American adolescents in Southwest Baltimore City. And my question would be, can the use of community-based research and exploring the beliefs and challenges of African American adolescents in Baltimore City with poorly controlled asthma improve asthma care outcomes? So the purpose of this presentation is to evaluate 5 models/theories that are relative to my study. So the first one is phenomenology, which was originally established by Edmund Husserl in the early 20th century. He defined phenomenology as the study of phenomena, the meanings of experience, and the conscious lived experiences as they are experienced by an individual's point of view. So it attempts to define experiences as they are lived. So this is relative to my study in nursing practice because the main purpose of this proposed study is to address the lived experiences of individuals affected with asthma, which accentuates the main focus of phenomenology. So my study is going to examine the various experiences that people have with asthma as they are experienced. So their personal experiences will not only define factors contributing to the phenomenon of poor asthma control, but it will also be considered as valued and fundamental to initiating community-based interventions that could minimize poor asthma control in the adolescents in Southwest Baltimore City. The next model is Betty Newman's system model, which focuses on human beings as open systems and their interactions with other individuals and their environment. So the meta paradigms that she uses for human being is, her definition of human being is an individual, a family, a community, a group, or a social entity. Excuse me. She describes health as a dynamic, continuous change between wellness and illness. She describes nursing as a profession that views a person as a whole, that is concerned with aspects that affect individual responses to stress and aims to stabilize the client system. And the environment, she says, are internal and external forces that affect and influence the client. So this is relative to my study in nursing practice because she also discusses primary, secondary, and tertiary prevention, which is widely used in nursing practice. Primary prevention in regards to asthma would be reducing the chance of encountering a stressor once that stressor is known. And with asthma, that would be prevention of sensitization to variables that may cause asthma. And according to WHO, they say that effective approaches for primary care of asthma have not been established and require further research. But secondary and tertiary prevention would involve instructing patients on how to identify asthma triggers, how to avoid them, maintaining healthy lifestyles, and properly using their prescribed medications. Next theory is Imogen King's theory of goal attainment, which focuses on interactions between individuals and individuals' desired outcomes. Is based on the relationships between patient, family, nurse, obtaining mutual goals, and the importance of the nurse-patient relationship. She describes nursing as helping persons that maintain health by increasing maximum functionality in patients. She defined person as open systems with unique wants and needs. And health is a constant adjustment to internal and external stressors through optimal use of resources. And the environment is how individuals interact with their environment. So this is relative to my study in nursing practice because the role of the NP would be building a proper NP to patient relationship through trust to education, sharing information, mutual goal setting, and developing methods that could achieve those goals. And the mutual goal to be achieved in this study would be increasing knowledge about asthma control, better overall control of asthma, and a reduction of asthma-related hospitalizations. And Tamarisi states that in nursing practice, the goal of health is obtained when patient and healthcare providers interact and collaborate to obtain set goals. So this is achieved by, always including the patient and family in healthcare decision making and working cohesively with other members of the healthcare team. The next one is the health belief model. And the health belief model states that there is a psychological and behavioral aspect to health-related behavior that, one, causes a desire to avoid sickness or get well if sick already, and two, gives the perception that certain health behaviors can be prevented or can cure sickness. So the concepts in this theory has several different concepts. Perceived susceptibility, which is an individual's subjective belief of the risk of obtaining an illness. Perceived severity, which is a person's perception of the severity of contracting an illness. Perceived benefits, which is individuals' feelings of the effectiveness of actions that can reduce or cure an illness. Perceived barriers, which are their perceptions of the difficulties they may be presented with when performing recommended health acts. And cue to action is the stimulus that prompts health acts, such as wheezing during an asthma attack, which lets you know that you need to use a rescue inhaler. The other concept is self-efficacy, which is a person's perceived ability to perform an action on their own. This is relative to my study in nursing practice because effective control of asthma can be more achievable once health behaviors of the affected individual or population is understood. This model focuses on individuals' beliefs regarding health conditions, which could assist to predict one's own health-related behaviors. Dorothy Arim's self-care deficit model. Self-care is defined as activities that individuals are able to perform for the purpose of maintaining their life, their personal development, and wellness. Individuals can care for themselves, but nurses can also assist if they have any type of health-related limitations. Arim also talks about nursing systems, which she says are implemented for those who may have any limitations in self-care. This is relative to my study in nursing practice because due to the chronic nature of asthma, self-care is very important. It's very vital in the proper treatment and control of the disease. And asthma self-care activities include learning about and avoiding personal asthma triggers, using rescue inhalers and other medications as prescribed, having an asthma action plan, and using a peak flow meter. And the NP's role is in patient education and promotion of self-care. The NP should educate patients on how to properly use medications, promote self-sustaining activities to implement in their daily lives, which will ultimately strengthen their self-care ability. So in conclusion, all of these 5 theories that were discussed, they have something in common, the importance of interpersonal relationships. None of these theories could be implemented if there isn't a good relationship between patients, nurses, providers, NPs, everyone in the healthcare system. All the theories mentioned can be used as an essential guide for understanding the beliefs and challenges of African American adolescents in Southwest Baltimore City who have poorly controlled asthma. That is my research topic, and by using any of these theories, it could lead to an improved asthma care outcome. Thank you.